I think we're in interesting times. I think some of the talks this morning have highlighted that. We've got work to do. I think the hospitals, the insurers and the clinicians, as many have said, need to work more closely together. How that's achieved, interesting question.
I think the bit that's exciting is the extent to which the industry could get together and get its act together in terms of producing a really good response to the information remedy requirement, using PHIN and other organisations of a similar sort of kind to put consumers into the driving seat, give them information so that they can see where the best healthcare could be provided. If we can pull that off, that would be a real step in the right direction.
As we've seen from the presentations today, it's been slowly changing, and it has been very much driven by changes in the regulatory industry. It's making lots of positive strides, and what we're looking at is over time more and more of the NHS work through choose and book is sort of splitting up by different providers, and more is being delivered by the independent sector.
Actually, today's conference has changed my view. I thought that private healthcare was a bit more on the upswing, but the numbers and trends presented today said it's a bit more either stagnating or in a decline, which means the companies need to be more creative about how they engage with it.
I am significantly concerned about the dominance of some of the organisations within it. So I think there are big insurers that have an effect on the market that's not to the benefit of everybody. And I think perhaps there are some other of the providers that are similarly placed.
This again, ONS, Office for National Statistics, current and projected spend on health as a percentage of GDP, and you can see that the dark blocks represent the effect of the Blair uplift on NHS spend and the momentum that's carried, and we are already seeing a decline, and we will see a further decline in this. So again, I'll make the slides available at the end of the session. So you've got two significant drivers. You've got a pretty lukewarm picture on the private side and a pretty precarious picture on the state side. So when we come to consider what's it all going to mean, what has it meant, let's keep those two things in mind. So let's come back then to the privately funded side and say what's going on in the market. And this is what we've been seeing in the market. So if you look at the driver of private medical insurers, the economy, we've seen a steady decline. We've seen a 20-year decline in the number of individual subscribers and a more recent decline in the number of corporate subscribers and lives. Now, we know that data in this area is really difficult to get hold of, and we know that Lang & Buisson is the best available data, but I don't think we know that it's 100% accurate. And if you sum the anecdotal responses and observations of a number of insurers, they probably would not agree that that market in terms of lives covered has fully recovered. Certainly what we're seeing is that...
From this morning's discussions, it just seems quite segmented in that there's a lot of different vested interests in consultants wanting their share of the private healthcare market and the insurance companies driving down prices, and it just seems quite a lot of different vested interests and the big, and it's causing problems for everyone.
I think we need to share more data. So all those parties, whether you're a hospital provider, whether you're an insurer, whether you're a provider like us providing MSK services, we need to be looking and sharing more data, because I think there's lots of answers out there. There's a lot of variation and variability, not just in pricing but in terms of outcomes. Nobody can compare anybody today. I can't honestly put my hand on my heart and say we're the best provider in the UK. I'd like to think we are, but I can't, because I can't compare myself actually on any single measure against anybody else today.
I think what's interesting, and the part of the debate that's been coming out of here, is the role that hospitals provide in private healthcare. And actually hospitals are, in one sense, a very expensive type way of delivering service. And so one of the debates coming up around consultants and new operators potentially is maybe more consultant-led services that might in the end compete with hospitals.
I think a lot of the points that were brought out this morning were something I've been banging on about for many years, with transparency and the changing directions and all of the things that we get complaints about from our international clientele has come out this morning. And we're all talking about it, but no one's taking the lead in actually doing it. And we've got other complications, obviously, with regards visas and stuff, which doesn't come out because it's not relevant. But all of the other issues that came this morning are extremely relevant for us in regards pricing transparency and working with each other and keeping the cost under control and everything that was brought out.
So we created what, when Apple told us, is the world's most comprehensive health monitoring system. And it doesn't just look at your fitness and your shape and the kind of stuff that the usual things do, but we look at the state of your mind, your heart, your kidney, your liver, your vitamins, your bones, your sugar, hormones, blood, all the things that people understand, and we can collect these informations as simply as we can from you. So we can tell you that, I don't know, how much you've been walking, how much you've been running, how much you've been cycling. We can show you the map of that, and we can show it, and we also can sync with 80 different devices that if you already have them, it automatically goes there. But that's the kind of thing a lot of people can do. We can also measure your calorie. We have Europe's or UK's most comprehensive calorie monitor. I mean, if I had something with a barcode, we can do it on a barcode, we can do it on what have you. So all of that we can do. But frankly, all that does, it kind of tells you that what's your weight like. And your weight is interesting to you, and it's interesting probably to your partner. Mine is certainly interesting to my wife, but it kind of doesn't tell you much apart from that. What we really worry about is that if you're gaining weight, how is the state of your mind? And how is the state? And I can see in this particular chap, for instance, he's not doing mentally very well. So when I look at the state of his heart, and I can see that his blood pressure is going up, and I don't know, let's look at the state of, say, his total cholesterol, and I see that is going up, I can now start to intervene. I think the private healthcare market is doing just fine. The problem is it's not doing as well as it should. It serves 10% of the British population, and from a revenue point of view, it serves about 5% of elective surgery, if you look at this conference. There is the other 50% of a spend in healthcare that has nothing to do with surgery or hospitalization, that we do very little on, although other parts of private healthcare do more on. And so if we were going to start changing our proposition, the future of private healthcare in UK will be incredibly successful. But we need to change our offer.
Well, let's be honest, it's fundamentally difficult, isn't it? So what do the hospitals and the consultants want to do? Maximise their income, maximise their occupancy. What do the insurers want to do? Get the hospitals and consultants to charge less. So you're starting off with a fundamentally conflict of interest, aren't you? Now, if we look at it from the patient's point of view, they want it all, quite rightly. They want to get a good price, but they want to be assured that they're going to a good place to get a good outcome. And therefore, I think from a patient perspective, we know what we're aiming for, but when you look at insurer and when you look at provider, there's a slight conflict of interest going on there. So it'll be tricky.
I think if you're looking at an industry movement facing up to the challenges globally from international competition, then somehow those individual parties need to come together to work better. It's difficult to see how that's going to happen because I think it's maybe a generational thing. You've got parties that are self-interested, and it's whether they can put those things aside, trust enough to work collaboratively.
Well, it's all looking very encouraging. I think Ali's presentation on technology was fascinating and how we're going to have to deliver certain aspects differently. Also, the whole noise around social media and patient feedback, I think that's going to be very powerful and something we've got to start thinking about and acting on differently.
I think they've got to go and look towards collaboration. I don't think they can do it on their own as individual units. I think there is areas around, there has to be a culture change, there has to be an understanding that private care is important and it's different from NHS. They have to be able to understand capacity and demand modelling in a different way. They have to understand that private patients want different access, and they want, that the consultant is actually at the end of the day the end consumer, and they are the primary customer. Whereas in an NHS environment, you can tell a consultant what to do. in their private practice, I think they would walk straight out the door if we tried to do that. So I think there is a sort of a significant cultural change that will need to take place, and I do think they need to then be able to collaborate with their other partners and the other NHS hospitals to be able to get the size and the scale to be able to compete with the existing private hospitals.
What I'll be looking for, what we'll be looking for, what we'll be trying to dig in with you about is evidence. Not anecdote, although anecdote can support evidence, but evidence for the quantity of demand. How many patients are there? How many qualified individuals are there? The quality of that demand. What are the features and characteristics by market segment that individuals are looking for that private healthcare providers can resonate with and better provide than its competitors? We'll look at, I will allude briefly to the supply, the available supply, both quantity and quality. Some of our panelists and presenters will get into that. We'll look specifically at competitive effectiveness to the extent that we believe that healthcare is an enterprise. I even heard the distinguished professor this morning talking about the industry. If we believe that it is an enterprise and an industry and an economic sector versus a social right and an obligation of the state, then we should apply good business principles, good marketing principles, good operating principles to the marketplace, and to our operations. It appears to contain some legacy obstacles to greater levels of coordination and cooperation, which are being supported, if not enabled, by some of the institutions in the marketplace. For example, there is the system of referring individuals, consumers, from the GP to the consultant and then to the hospital. And that creates an intermediated series of referrals with each party having some interest, some stake in the game. Each party's a stakeholder, and that adds a level of complexity that is difficult to overcome.
I'm Keith Pollard, I'm the CEO of Intuition Communication. We ran today's event. What stimulated it was the Competition and Markets Authority review of the private healthcare sector, and our aim was really to bring together everyone to see whether that was going to stimulate real change in this industry.
There's an awful lot of competition out there, and I think everyone's got to focus on quality and the patient, and I think that will in the long term pull through. I think that's, in outcomes, I think we all have to demonstrate how good we are. And it's not just good enough to say you're good at it. You have to demonstrate that and prove it.
In the UK, I'd like to see the private sector market really working more in collaboration in looking at how they exploit very large market for patients coming from these high growth areas around the world, so that we get more revenues for the UK. And too often we see the private sector competing against itself, competition, but if they saw how big the market is overseas and they could establish a London or a British capability for dealing with overseas patients, then I think everybody would win from that, and especially the British economy.
It's been an excellent day. The quality of the speakers, the contributions from people, and I think most impressively the debate and openness of the people who've attended the event has been absolutely excellent.
The highlight for me today has been that there's been so many people here from all angles of what is an industry and not just a service. And there's insurers here, there's hospital providers here, there's consultants here, there's others that provide services to that industry. And the common theme that I've picked out has been that the most efficient way of providing things is to do things right first time. High quality services means less risk, less cost, and better outcomes. And that's clearly going to be more open in the future through the internet. Everyone's going to be able to know more about what goes on. That can only be better and safer for us all in the long run.
I think the question now is whether the CMA report and what's going on in the industry at the moment will stimulate real change and will encourage the different players in the market, the insurers, the providers, and particularly the doctors to work together to create a new model of private healthcare, because that's what we need.